Hello, everyone, and welcome back to NCOIL One-on-One. I'm Pat Gilbert. With us today is another Pat Gillespie, Regional Vice President of State Affairs for WellPoint. Pat, thank you so much for taking the time.
Thanks, Pat. Glad to be here.
Yeah. So let's hop right in. Can you tell us how you first got your start working in public policy?
So I first got my start working in campaigns and in politics. And from there, I was able to work for Congressman Frank Pallone, who's our local congressman and now the ranking Democrat on the House Energy and Commerce Committee from the Jersey Shore. And then really spent the bulk of my career, Pat, working for the state of New Jersey, 18 years, both at the state Senate and also in the governor's office. But the first job I had in politics and government was working on campaigns.
That's great. So it sounds like you got a lot of good experience. So can you kind of pivot now to some background on WellPoint, what you do in your current role?
Sure. I'm a regional vice president for Elevance Health, and I operate across the Northeast region, which for Elevance includes Maine down to Virginia. And in that role, I support the local New Jersey health plan, which goes under the brand name WellPoint. But we have now health plans we have 14 health plans at Elevance Health that are Blue Cross Blue Shield licensees. And we use the Anthem brand there, Anthem Blue Cross, including in New York, Connecticut, Maine, New Hampshire. And then we use WellPoint largely for our Medicaid business or other non-blue businesses. And we're WellPoint here in New Jersey and in Maryland, DC as well. And so we've operate, across those two brands in conformance with the Blue Cross Blue Shield Association rules. And like I said, we're blue in 14 states. We do operate across Medicaid, Medicare, commercial. We also provide other healthcare services under the Carelon brand, including behavioral health services, pharmacy services, and other healthcare services as well using the Carelon brand.
That's great. So it sounds like you definitely have a full plate. Can you tell us how you first came to cover NCOIL and what the participation from Elevance has been like over the years?
Sure. So we've had a long and really successful relationship with NCOIL as a corporate and institutional partner. I think that we first joined NCOIL at the CIP level was probably about 8 years ago, right when I started here at Elevance Health. And it's been, a great relationship. We get a lot of value out of it. We're very active with the NAIC as well, National Association of Insurance Commissioners, and I think there's a lot of commonalities and synergies between the two in terms of crafting health insurance policy and other insurance types of policy. And so we've been going to NCOIL now and participating at the CIP level, as I said, the corporate institutional partner for the last 8 years.
That's great. So what are some of Elevance's top policy priorities in 2025 and beyond?
So we were very supportive in the model that just passed around facility fees, the affordability model law that passed at the Charleston meeting in 2025. We've been working on that model draft and supporting it along with the Blue Cross and Blue Shield Association throughout the course of 2024 and then into 2025, where it was adopted by the full NCOIL body. And we think that as health systems have gotten bigger through consolidation and vertical integration, that's really an important model law to help consumers and help to maintain the affordability of health plans and certainly maintain affordability for consumers, whether it's through their premiums, their cost sharing, or however they're contributing. And it's also really a notice issue about understanding where facility fees are coming into play with how the healthcare dollar gets spent. So we thought that was a critical and important model for NCOIL to adopt, and we're very happy that it was successful and that it's been adopted.
That's great to hear. So obviously you're very involved in NCOIL. How would you describe your personal overall experience participating with the organization?
Yeah, I think it's been very productive and it's been very helpful. The group has done a lot of important work, and not only with the models that they use, but also with the informational seminars that they have and the informational programs, in addition to the work on the models. And then it's also important for Elevance Health and for me personally because it helps us with relationships with state legislators. And there's certainly a core group of legislators who attend NCOIL meetings regularly. And it's certainly we have customers in all 50 states, and so We have domestic health plans in 36 states. So we also then, it's an opportunity for us to meet legislators outside of their home state sometimes in a less than formal setting, and an opportunity for us to help, deepen relationships that we may have back in the home state already.
That's great. So Elevance and NCOIL definitely have a very strong relationship and partnership, but there are, of
Mhm.
course, over the past few years, a lot of new companies coming in who maybe haven't
Mhm.
had as much experience. Do you have any advice for new attendees coming into NCOIL to kind of hit the ground running?
Yeah, I think for the new CIP members, it's just a question of coming to the meetings and making sure that you're able to circulate during some of the more informal sessions. And even for legislators, I think for first-time legislators who are coming to NCOIL meetings, it's important, I think, for them, and I can say for me personally, the informational sessions that are maybe beyond health insurance. So we're a health insurance company, so obviously my primary focus is to talk and to learn more about health insurance related matters. But even the other informational seminars for legislators or for other, corporate partners are important as well. So, for example, at one meeting, we had a whole session on fire risk and property and casualty, which is not something that I had really been exposed to, but was very informative. And even on some of the banking issues that we've talked about, like micro lending, some of those sessions I wouldn't normally attend, but again, the issue was interesting. I think I learned a lot, and it's a way to broaden your horizons to a certain extent and understand pieces of policy that you might not encounter on your, in your daily job. So whether it's for a CIP partner or a legislator that maybe focuses more on health than on property and casualty, and NCOIL's an opportunity to learn more and to get exposed to different kinds of insurances, different kinds of products, and different kinds of policy issues that you wouldn't necessarily see on a daily basis.
That's great. So, as the meetings have kind of evolved and grown in size, it can sometimes be harder to make real relationships. Have you found that? Do you see that kind of percolating at all?
Yeah, I mean, again, it's a good thing that the meetings have grown, and I think it's a good thing that there's a lot more interest in NCOIL, and the attendee list seems to grow at every meeting. The number of folks attending, the number of legislators, the number of corporate institutional partners. I think that again, I would, as a piece of advice, or for us, it's an opportunity informally to talk to folks at the events, talk to folks in between the meetings, set up meetings with legislators. And I know NCOIL provides meeting space, meeting rooms, and additional opportunities to meet with legislators one-on-one. And again, I think that's very valuable and part of the core function for the group. So again, I think as the meetings get bigger, it is an opportunity again to meet more people, understand the full width, breadth, and scope of the insurance industry. So you got to go to the meetings, though. So you got to go to the meetings and try to participate. And the interim meetings are still on Zoom largely, but it's really, I think the in-person meetings are the more valuable experience. And that's, again, an opportunity to see people and to learn more and to have some informal interactions outside strictly a state house or a state capitol meeting.
It's great. Yeah. So speaking of, bringing people together and coming to the meetings, it's our goal to bring legislators and interested parties into the same room to develop model legislation that then can be taken back into the state
Mhm.
legislatures. Have you seen NCOIL's efforts kind of disseminate out in the states?
I have, and I see again, each state is kind of its own unique being, and each state legislature will have its own unique rules, its own unique, um, sorts of customs. And it's one of the things I really like about this job is working across multiple states, having experience in New Jersey, but also now having experience in New York and Maine and Maryland and Virginia. The rules can be very different there, and the policy, the institutional sort of things can be very different there, and the experience of the industry can be very different. So I think the important thing about NCOIL models is that it's an opportunity for a collaborative relationship and a collaborative process with the members and the staff, and that these are intended to be national models as opposed to sort of verbatim things, because not every state is going to take any model and just simply do it cut and paste and verbatim. They're going to add their own spin to it. And certainly with things like the dental insurance model, that's been a long time model that lots of states have adopted. But, it's important, as a guidepost, I think, for legislators back in their home states, just with the expectation that in a lot of ways, legislators will take the NCOIL model and then refine it, amend it, change it to try to reflect some of the local circumstances. And that's valuable. And I think that kind of a give and take in any legislative process is valuable. And certainly at NCOIL, I think that's been the standard since we've been participating there.
That's great, and that's always the goal, so that's good to hear. Naturally, we've discussed some of the positive things about NCOIL, but there's, of course, always things we want to improve on. As somebody who's been involved, how would you like to see the organization kind of grow and evolve in the years to come?
Yeah, I think the again, I think the challenge is to try to focus the work and focus the activity between the models and the other information that can be provided, to benefit the NCOIL legislators, the members. And I think the organization's doing a good job in providing that balance. And I would hope that moving forward, that would be maintained so that there would be work on the models, but also work on things outside the models that, because there's so much out there, information wise. And the idea that, the NCOIL attracts experts who, are not necessarily lobbyists, which is a good thing, to come and talk about these issues, and to provide information more than anything else, to legislators. And so I think too, the meetings are very successful, and I know that, balancing the meeting schedules can be a challenge. I personally don't like it when the meetings bleed into the weekend, but some of that can't be helped. And I know other groups like NEIC, they often do that as well, meet on Saturday and Sundays. But again, if that would be the one change, it would be don't meet on Sundays. But
I'm sure a lot of people probably share that same
yeah,
sentiment.
I know sometimes that can't be helped, and you're picking dates, locations, and doing hotel contracts years in advance. So I get it. But again, like I said, I think in terms of the substance in the work of the organization, it's been a good balance, and the processes and the process, has been very fair.
Yes, we very much appreciate those insights.
Mhm.
Before we let you go, we have a quick lightning round of questions to ask you.
Okay.
Let the viewers get to know you a little bit better. Can you tell us your favorite all-time movie?
So, I have a lot, but The Third Man is probably one of my favorite all-time movies.
I'll have to add that to my list. Favorite
Mhm.
all-time actor?
Is John Wayne.
Great answer. Food.
Food is it's Jersey. I'm from Jersey, so pizza.
Same.
Right.
I have to agree with you there. Favorite book or author?
So I really enjoy, Robert Caro's books. The LBJ series of books and The Power Broker are not exactly light reads, but they're excellent, excellent work, and biography and history.
Nice. Song or musical artist?
So I always use, "Lawyers, Guns, and Money" by Warren Zevon, one of my favorite songs. So,
Nice. TV show?
Seinfeld.
Popular answer. And then
Yeah.
last one, three dinner party guests, living or dead.
Oh, three dinner parties. Yes. Well, I probably want. I think, well, they're all dead, but John Lennon, Abraham Lincoln, and FDR. I think that would be an entertaining dinner.
Fantastic answers all around. This wraps up this month's NCOIL one-on-one interview. Pat, thank you so much for taking the time.
Thank you. Appreciate the opportunity. Yeah. Thanks.